Have you ever wondered exactly when your baby should start eating solid foods? It's a big milestone, but also one that can be a little confusing. Don't worry, you're not alone. Today, we're going to break it down clearly using trusted guidance from US pediatric experts. So grab your coffee, take a deep breath, and let's talk baby food basics. Welcome back to Newborn Care Guide, the place where new parents come for real answers and peace of mind. If you're here, you're probably looking for signs your baby's ready for that first spoonful of mashed banana or oatmeal cereal. And good news, we're covering everything you need to know, straight from the American Academy of Pediatrics. Let's get into it. So, when should babies start solids? According to the American Academy of Pediatrics, most babies are ready to start solid foods around 6 months of age. Not before 4 months, no matter how hungry they seem, and usually not after 6 months. That 6-month window is considered the sweet spot because your baby's digestive system, oral motor skills, and nutritional needs all start to shift. But remember, every baby is different. Age is a guideline, not a deadline. Look for these key signs of readiness. Before offering that first bite, your baby should meet these milestones: good head and neck control. They should be able to sit upright with minimal support. Interest in food. Does your baby watch you eat and maybe even try to grab your food? That's a great sign. Loss of the tongue thrust reflex. In other words, they don't automatically push food out with their tongue. Able to open mouth when a spoon is offered. Seems simple, but it's an important developmental sign. If your baby isn't showing all of these signs yet, don't worry. Give it time and check again in a few weeks. What foods should you start with? Great question, and yes, it matters. Pediatricians recommend starting with single-ingredient foods that are rich in iron and zinc, like iron-fortified baby cereal, oatmeal or rice, mixed with breast milk or formula, mashed avocado, pureed sweet potatoes, mashed peas, pureed meats or beans. Stick with one new food at a time, and wait about 3 to 5 days before introducing another. This way, you can spot any allergic reactions, like rash, diarrhea, or vomiting. What about allergens? Here's where things have really changed in recent years. The latest guidelines from the IAP actually encourage introducing potential allergens, like peanut butter, eggs, and yogurt, early on, starting around 6 months, especially for babies at higher risk of food allergies. Of course, always consult your pediatrician if your baby has eczema or a family history of allergies. For peanut butter, don't just offer a spoonful straight out of the jar. That's a choking hazard. Mix a tiny bit into cereal or puree instead. How often should you feed solids? At first, solids are more about exploration than nutrition. Breast milk or formula should still be the main source of calories until around 12 months. In the beginning, once a day is perfect. Just a few spoonfuls, whenever baby is alert and happy. Over time, you'll gradually increase the frequency and variety. Think of it like baby's practice round before joining the family dinner table full-time. And a quick note on what to avoid: no honey before 12 months. It can cause infant botulism. No cow's milk as a drink until after the first birthday. Avoid foods that are choking hazards, like grapes, hot dogs, popcorn, and raw carrots. And skip added sugars and salt. Baby's kidneys and taste buds just aren't ready yet. Starting solids is a big, exciting step in your baby's growth, but there's no need to rush. Follow your baby's lead, watch for the signs, and always talk to your pediatrician if you're unsure. You're doing great, and every tiny spoonful is a chance to bond, explore, and learn together. If you found this video helpful, be sure to like, subscribe, and share it with other new parents. And don't forget to check out our other guides here on Newborn Care Guide, where we take the guesswork out of parenting, one step at a time. Thanks for watching, and we'll see you next time.